the 15-minute or less lecture series, Anatomy and Physiology, Chapter 16, Respiratory System, Part 2. Disorders of the lungs, smoking. Well, smoking is bad for you. All smoke inhalation is bad for your lungs, whether it comes from tobacco or marijuana or burning plastic, although some smoke might be worse than other smokes. Effects of tobacco smoking, persons becomes easily winded. This is for a lot of reasons. One, nicotine constricts the terminal bronchioles, decreasing airflow. 2, carbon monoxide will bind hemoglobin. This reduces the amount of oxygen being carried by your red blood cells. 3, the irritants in smoke increase mucus production, which will impede airflow because it's taking up space that air would be in. 4, the irritants can also destroy cilia, making it more difficult to remove the irritants and mucus, and also often leading to what's called a smoker's cough as a way to get that mucus out of the lungs. And 5, it can destroy elastic fibers in the lungs, can cause bronchioles to collapse, meaning there's less areas in the lungs where gas exchange can occur. Emphysema can be a cause of long-term smoking. Emphysema is where the actual alveolar walls are damaged and broken down, meaning that there's less space within the lungs in which gas exchange can occur. For example, here is healthy lungs with lots and lots of nice alveoli, and here is someone with emphysema. And as you can see, there's not a lot of space left for gas exchange. Lung cancer, the odds of getting that increases dramatically if you are a smoker, and is the leading cause of cancer in the U.S., with most people who are diagnosed with it dying within the first year. The most common kind of lung cancer is bronchiogenic carcinoma, where the cancer starts in the epithelial lining of the bronchial tubes, which makes sense because that's what's going to be exposed to the carcinogens first. All right, if we go to the brain, we see that the brain has control over breathing. It has certain respiratory areas within the brain stem, and these areas cause us to inspire, breathe in, and expire, breathe out in the pattern and rate that we are used to, and can also adjust that rate and the depth of breathing depending on what our body needs. So within the medulla oblongata is the medullary rhythmicity center. Here it controls both the basic rhythm of breathing and also controls the respiratory muscles needed for the breathing process to occur. Also, there is the Pontine respiratory group in the pons, and this helps to control the rhythm of breathing by limiting inspiration. So the point of this is to help prevent over-inhalation so that you don't overexpand the lungs and damage them. That would be bad. So the Pontine respiratory group helps to control what's going on by the medullary respiratory center, which controls the respiratory muscles and the overall rate and depth of breathing. In fact, other factors that can affect breathing includes chemicals, especially those in the blood. If certain chemicals at certain levels, then you may breathe faster or slower. The limits to the lung tissue and how much you can stretch, your emotional state, and your relative health. If you have a respiratory infection, it's going to be more difficult for you to breathe. All right, so chemosensitive areas. We have chemoreceptors in our major arteries that are detecting the concentration of carbon dioxide in the blood and also the concentration of hydrogen ions, aka the pH of the blood. Now, where does the carbon dioxide in the blood come from? Well, it comes from cellular metabolism. Our cells are constantly producing carbon dioxide as they produce ATP, the energy we need for our cells to function. So if we have high levels of carbon dioxide or high levels of hydrogen ions, which is a low pH, in the blood, this signal will be sent to the central nervous system and lead to an increase in breathing rate, so that we'll breathe in and out faster and deeper so that more carbon dioxide is exhaled. And this would then lower the levels of carbon dioxide in the bloodstream. And as a consequence, when you lower the amount of carbon dioxide in the bloodstream, you also lower the amount of hydrogen ions, which would then raise the pH. So when we exercise and we start needing to make more ATP in our muscle tissues, we end up producing more carbon dioxide, and that causes us to breathe faster and harder when we exercise. So it's not oxygen that we're breathing harder for, it's to get rid of the carbon dioxide. If you have low levels of carbon dioxide or low levels of hydrogen ion, this also will affect other fluids in the body, such as the cerebrospinal fluid. And so to help prevent damage to various tissues of our body, our breathing rate will decrease. We'll breathe slower, we'll breathe in less deeply, and that means less carbon dioxide is exhaled. We're losing less carbon dioxide when we breathe out. And so over time, the amount of carbon dioxide in the bloodstream will increase, which will also increase the amount of hydrogen ions in the bloodstream. Hyperventilation. Hyperventilation is when someone's breathing in and out really, really fast. And for some people, say having a panic attack, they may be hyperventilating uncontrollably. And this causes a increased loss of carbon dioxide, which means that the lowers amount of carbon dioxide in the blood, raising the pH in the blood, which raises the pH in other fluids like the cerebrospinal fluid, which is bad for the body as a whole. So if you are hyperventilating uncontrollably, the only thing your brain knows how to do is stop you by causing you to faint. Because when the person faints, then their breathing will slow down, decreasing the loss of carbon dioxide. Now, when we see someone hyperventilating who can't stop doing it, often what they have them do is breathe in and out of a paper bag. This is a good thing because as they breathe in and out, the amount of carbon dioxide in the bag increases, decreasing the amount of carbon dioxide they lose from breathing out. But again, use a paper bag, not a plastic one. All right, if you hyperventilate in a controlled manner, so you just breathe in and out really fast for a little bit, say a minute or so, then you will lower the amount of carbon dioxide in your blood. And this will then allow you to hold your breath longer than you normally can. So for instance, you have the normal levels of carbon dioxide in your blood, you hold your breath, and it takes a certain amount of time to reach the build-up point in which your body says, hey, we have to breathe out now because there's too much carbon dioxide in the blood. So it takes a certain amount of time normally. If you hyperventilate first, that lowers the amount of carbon dioxide, which then increases the amount of time it takes to have your carbon dioxide levels in your blood rise enough to make you want to breathe. So by hyperventilating first, you can hold your breath longer. All right, we also have peripheral chemoreceptors within some of the major arteries that are checking blood oxygen concentration. And if you get really, really low oxygen levels in the blood, then this will lead to an increase in breathing rate and breathing depth. However, the blood oxygen levels have to get extremely low to stimulate these receptors because, again, we are very efficient when it comes to oxygen. So it ends up being the carbon dioxide which really determines our rate of breathing. We also have an inflation reflex, again, partly controlled by the Pontine respiratory area in the pons. And this is to prevent us from overstretching the lungs by breathing in too much. So it is impossible for you to overinflate your lungs to breathe in too much air, no matter how hard you try, unless you use something else to help force the air in, and do not do that because you do not want to damage your lungs. All right, gas exchange does not occur as the air is traveling through the bronchial tree. It occurs specifically in the alveoli. So at the very ends of the terminal bronchioles, we then come to the respiratory bronchioles, which split to the alveolar ducts, which go to these alveolar sacs that look kind of like clusters of grapes. And each individual grape is an alveolus. And it's there in the alveolus that we have the gas exchange occurring through the very thin walls of the alveolus, which is made up of thin, simple squamous epithelial cells. So as you can see down here, they're super, super thin, these walls, with plenty of space for air. Now, wrapped around the alveoli are all these blood capillaries, these pulmonary blood capillaries. And so the gas exchange occurs through what's called the respiratory membrane, which means through the wall of the alveolus and the wall of the blood capillaries. So we have two thin, simple squamous cells and their basement membranes. And the gas exchange occurs between this structure. And again, the structure is called the respiratory membrane, with carbon dioxide entering the air of the alveolus and oxygen entering the bloodstream in the blood capillaries. So again, gases move from high pressure to low pressure, sort of similar to how things move from high concentration to low concentration. So we have higher pressure of carbon dioxide in the bloodstream than outside. So carbon dioxide leaves and enters the alveolus. And we have a higher pressure of oxygen in the alveolus and lower in the bloodstream. So the oxygen will leave the air of the alveolus and go into the blood capillaries and then get carried primarily by the erythrocytes. So simple diffusion across the respiratory membrane. And this is, as we learned earlier, called the external respiration. Again, most of the oxygen is carried by hemoglobin within the red blood cells, with a little bit dissolved in the plasma itself. And as I already mentioned, red blood cells are also known as erythrocytes. And then the oxygen gets released when we get down into the tissues. This is because when we get to the tissues and the carbon dioxide is going into the bloodstream from the surrounding tissue fluids. This increases the amount of carbon dioxide in the blood, making it more acidic, which makes it easier for the oxygen to leave the bloodstream and enter the tissues. Although, to be honest, the biggest factor is the fact that we have a high pressure of oxygen in the blood capillaries in the tissues and a low oxygen pressure in the fluids surrounding the tissues. So basically it's the pressure, but what also helps is acidity caused by the carbon dioxide. Hypoxia is when an area of the body does not receive sufficient oxygen. This can be seen in areas, say, in the nail beds can turn blue, around the lips could turn blue. Sometimes getting some chest pains could just be caused because the heart is not getting enough oxygen. And severe cases of this can lead to someone going unconscious. Carbon dioxide transport. Again, it starts with the carbon dioxide entering the bloodstream from the tissues. There, the carbon dioxide is carried a little bit by the hemoglobin. About 23% is carried by hemoglobin in a separate space from the oxygen. Some of it's dissolved in the blood plasma, and most of it, about 70%, gets turned into carbonic acid, which then becomes hydrogen ions and bicarbonate. And so this is why carbon dioxide levels, if they go up, cause the blood to become acidic, because carbon dioxide reacts with the water to become an acid, giving us a hydrogen ion increase and the bicarbonate ions forming. So that is how carbon dioxide primarily is carried in the bloodstream as an acid. And then when we get to the lungs, the carbon dioxide that is dissolved in the blood plasma will leave and go into the air space of the alveoli, and this will cause bicarbonate ions to return to their carbon dioxide form, and then they will also leave. And so that is why carbon dioxide is able to leave at the alveoli, because it's basically following that pressure gradient that I talked about earlier. And here is just a quick overview of how oxygen is carried in the bloodstream versus carbon dioxide. Please hit like and subscribe below.